Hi, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care, and today we're going to talk about the spectrum of transition options available to you as an older adult and why choosing between them is far more complicated and far more complex than anyone prepares you for. Because you see, when most people think about gender transition, they imagine an all or nothing journey: hormones, surgeries, complete social transition, legal name change, the whole package. But here's what I've learned after 20 years of working exclusively with transgender adults: full transition isn't the only option. And for many people over 35, it's not even the right option. This isn't a how-to guide, so today's video is not going to give you a complete template how to do it. But it is about understanding the questions you need to answer, questions that don't have easy answers, and the complexity behind those questions. So let's talk about what partial transition actually means and why the decision between full and partial approaches might be one of the most complex one you'll ever make. First of all, let's define what we're actually talking about when we say full transition and partial gender transition. Full transition typically includes hormone replacement therapy, multiple gender affirming surgeries, complete social transition, such as name change, pronouns, presentation, legal documentation change, and an individual usually out in all areas of their life: work, family, community. Partial gender transition, on the other hand, might include any combination of social transition only, in other words, no medical interventions, hormones without any surgeries, any, for example, top surgery but no hormones, private transition, out in some contexts but not being out in others, selective medical interventions, presentation changes without any legal name change, and microdosing hormones for subtle changes. Partial gender transition isn't lesser version of transition. Let me say that again. Partial transition is not a lesser version of transition. They're different approaches that might be better suited to your specific life circumstances, your specific goals, and your specific needs. But here's where it gets complicated for older adults. When you're 25, you might think, I want everything. I want to live as my authentic gender in every area of my life. When you're 45, with a 20-year marriage, 3 kids, and an established career, you might think, I need relief from dysphoria, but I also need to protect the life I built. So how do I balance this? And that's not a simple question to answer. You might wonder, why would anyone actually consider partial transition at all? And that brings me to 6 main reasons why older adults consider partial transition. By the way, make sure you stay till the end of the video. I know it's going to be a lengthy one because I will share with you big questions you ought to ask yourself to dig deeper if you are considering partial transition. But for now, let's focus on 6 main reasons. You know how much I love grouping things in categories. I'm going to give you 6 that I've seen in my 20 years of practice that show why older adults may want to consider partial transition. And this is for adults over 35. And I'm also going to share with the 6 reasons common challenges that arise with each decision. Most common reason number 1 is for career protection. Let's say you've spent 20 years building professional credibility and relationships. You're at the peak of your earning years. Full social transition at work might mean starting over in your field, potentially, loss of professional network, reduced income at a time when you can't afford it, and explaining your transition history for the rest of your career. Some clients choose to be on low dose hormones, for example, but remain boy mode, this is for trans femme, at work, or to separate the professional identity from their gender transition. So that's what it might look like. But here's the problem with this. Living split lives creates its own psychological burden. You get dysphoria relief from medical changes, but you're still performing the wrong gender 40 plus hours a week while pretending to be boy mode at work. Now, is that sustainable? For how long? What's the psychological cost of that? Reason number 2 why people choose partial transition is to preserve marriage. For example, your spouse married someone of a particular gender. They might be willing to stay if you don't fully transition, but draw a line at a certain changes. Maybe your spouse can accept you dressing differently at home, you taking hormones, you being non-binary rather than binary trans. But your spouse cannot accept you presenting as another gender publicly, you having certain surgeries, them, your spouse, being seen as gay or straight relationship when that's not their orientation. Some clients choose partial transition in this situation to save their marriage. But then they end up living with questions. Am I sacrificing my authenticity for my relationship? Will I resent my spouse? Will this compromise ultimately make me more dysphoric? Reason number 3 why somebody may decide partial transition is financial constraints. Full medical transition is expensive. At 45, you might be thinking about college tuition for your kids, if you have kids, aging parents who need support, if that's your situation, retirement savings, and existing mortgage or any debt. You literally cannot afford full transition right now. So you choose what you can afford. So you go with partial transition. But then the challenge arises. Am I making permanent decisions based on temporary financial limitations? Will I regret not doing more when I had the chance? How do I live with partial relief? Reason number 4 why somebody might consider partial gender transition is health risks. At 40 plus, your health risk profile is different than it is at 20. You might have cardiovascular concerns that complicate hormones, maybe cancer histories that contraindicates hormones, maybe chronic health conditions affected by medical transition. Maybe you are at higher surgical risks due to your age. So your doctor might recommend against certain interventions. So you're left asking, how do I manage dysphoria when some medical options are off the table? What's the risk-benefit calculation here? Who decides what's worth it? Reason number 5, when somebody decides partial transition, is because of your relationship to your children, if you have children. So those are for those of you who have kids. Let's say you have kids, maybe teenagers, maybe young adults, maybe young children, and you're thinking, will full transition damage my relationship with my children? Will they be bullied or ostracized because of me? Am I being selfish by transitioning fully when they're still at home? How much do I sacrifice for their well-being? Some clients transition socially everywhere except at their children's school, or wait until kids are out of the house. But the question for them becomes, am I teaching my kids to hide? Am I modeling authenticity or am I modeling a compromise? What's the right answer here? Reason number 6 why somebody may decide to partially transition is community and social situations. Let's say you live in a small town, a conservative area, a tight-knit religious community. Full transition may mean losing your community, becoming isolated, facing hostility or danger, leaving behind decades of relationships. Maybe you choose to transition partially. Be yourself online, in the city, with chosen friends, but remain closeted in your private community. But can you sustain that long term? What's the psychological cost of geographic splitting? Now, those are 6 most common reasons why older adults may decide partial transition over a full transition. Now, let me walk you through some specific partial transition approaches, in case if you're considering them, that I especially see clients pursue, and I also want to share complications that each one brings. For each one of the 6 scenarios, I'm going to share what partial transition looks like as an option, why it tends to be appealing, what's the appeal behind it, how it helps, potential complications, and the questions that it may bring up for you. Scenario number 1. By the way, if you're halfway through this video and you're enjoying it, give it thumbs up and subscribe if you haven't yet. Helps the channel very much so. So scenario number 1, social transition only. This is when somebody only socially transitions as part of their partial transition and they're not stepping into any medical transition at all. What does the scenario looks like? It looks like you changing your name, pronouns, changing your presentation, how you present, and you ask to be treated as your identified gender. You're not taking any hormones and you're not having any surgeries. Why is this appealing approach? It is reversible if needed. It has no medical risks. Has very low cost associated with it, and it's very fast to implement. Now, the complications that may arise out of this approach. For many people, this doesn't relieve body-focused dysphoria. You may also not fully pass, for if passing matters to you, which may create ongoing dysphoria. People may not take your identity seriously without medical transition. You're constantly explaining and defending your choices. You might feel like you're not trans enough. Now, here are some of the questions that may arise taking this approach. If social transition alone doesn't relieve my dysphoria, does that mean I need medical interventions? Or does it mean something else is going on? How do I know if I should stick with this or pursue more? Am I giving up too easily or am I being realistic? These are some of the inner conflicts that can arise within you. Scenario number 2 of what partial transition approach looks like. That's when somebody takes hormones without any surgery. Now, what would that look like? It may look like hormone replacement therapy, which provides physical changes over time. There's no surgical interventions, and a person might also come out socially or might not. Why is this appealing approach? It gives significant body changes. It offers improved gender alignment. It is much less invasive than surgery, and you can stop if needed. Also, some changes are going to be permanent based on the hormones. What are some complications with this approach? Hormones may create visible changes that eventually out you whether you're ready or not. You might pass in some contexts, but not others. Again, if passing matters to you, creating constant anxiety. Your body changes, but your legal documents don't, and that creates complications. Some dysphoria remains if surgeries are ultimately needed. And family or your spouse might accept hormones, but not coming out publicly. Some of the inner conflicts as questions that may arise inside of you as a result of taking this approach. How do I manage the timeline of physical changes versus social coming out? What happens when I can't hide the changes anymore? This is a common one. How do I hide the changes? What happens if people start outing me? Am I creating a situation where I'm forced out before I am ready? How long can I live in this in between state? Scenario number 3 of what partial transition may look like. That's when somebody decides stop surgery only. This is very common with non-binary and trans-masculine individuals, less common with trans femme, but still happens too. What that looks like. Chest masculization or breast augmentation. No hormones, and a person might socially transition or might not. Why is this appealing partial transition approach? Because it addresses a specific source of dysphoria, chest dysphoria, which is very common, especially for non-binary and anybody who is identifies with masculine gender spectrum. It's one-time intervention. It doesn't have, a person doesn't have to commit to full medical transition, and a person can live as a non-binary rather than binary trans identity. What are the complications in terms of issues that might arise? Explains the chest, but other physical characteristics remain. Might not pass without hormones, again, if passing is important. Post-surgical chest might not match the rest of your body, depending again how you see your body. May increase dysphoria about other areas, and others might assume you're fully transitioning when you're actually not. So questions this approach may arise within you that creates conflict. Will fixing one source of dysphoria makes the others worse by comparison? Am I solving the right problem? Is this enough, or am I delaying the inevitable? How do I know when to stop versus when to keep going? Scenario number 4 of potential partial transition. That's when somebody decides either to privately or selectively some part of transition. So what does that look like? When somebody is out in some context, so let's say you're out online with friends in certain spaces, but you're closeted in others, at work, family, religious community, for example, might medically transition, but present still as your birth assigned gender in certain settings, and you end up living compartmentalized life. Why this partial transition approach might be appealing? Because it protects important relationships and roles. It allows exploration without full commitment. It maintains safety in hostile environments, and it gives you control over who knows. Some of the complications of this approach. It is exhausting to maintain separate identities. There's constant fear of being found out, difficulty remembering what you've been told by whom, can't fully relax anymore, and relationships based on deception or omission may start to feel very inauthentic. Some of the inner conflict questions that this approach may bring up in you is, how long can I sustain the split? Is this protecting me or slowly destroying me? Am I being strategic or cowardly? What's the difference? When does compartmentalization becomes dissociation? Scenario number 5 of partial transition is when somebody decides to microdose hormones. What does it look like? Very common one, by the way. Very low dose of hormones for subtle changes. Goal often is androgyny or slight shift, but not full transition, or the goal is to psychologically reduce dysphoria. Slower timeline, and there's more control over extent of changes. Why is this approach appealing? Because it reduces dysphoria without dramatic changes. It flies under the radar socially, and it allows you to test medical transition, and it might be enough of relief to cope with dysphoria. Some of the complications that arise out of this approach. Changes are subtle, might not actually relieve dysphoria adequately, hard to maintain perfect balance. Medical providers might not support this approach. Still, some providers don't do microdosing. And you're in perpetual limbo, never fully one or the other. And it's difficult to know if you need more or if this is your endpoint. Some of the questions that might arise as a byproduct of this approach. Am I compromising because of fear or because this is genuinely right for me? How do I distinguish between this is enough and I'm settling? Is there such a thing as enough transition? And finally, scenario number 6 of example of partial transition is when somebody does full medical but partial social. What does it look like? That's just to explain, that's when somebody gets complete medical transition, hormones and surgeries, but they do it in a way where they're not really social out, almost like they have done it and started their life all over again and never ever disclose their transgender history. So in other words, they try to pass as cisgender person. The appeal about this approach is that there's body alignment without any social disruption. Privacy can be maintained. People don't have to be quote unquote trans-identified socially, and they can start over without transition history following them around because they're hiding that history. But this approach carries complications. It carries, in my opinion, the worst complications. One of the complications is constant vigilance and fear of being clocked, which leads to a tremendous amount of ongoing hypervigilance and anxiety and stress. It leads to a person not being able to discuss their past authentically because they're trying to hide it. Medical history becomes secretive. Dating an intimate relationship require disclosure at some point. Isolation from trans community and their shame about being trans that starts looming large and affecting one's life. Some of the questions that may arise for a person going through this part of partial transition is living styles freedom or hiding? Am I protecting myself or rejecting part of myself? What's the psychological cost of secrecy? Can I have authentic relationships while withholding this information? That's a really big one. So now that you're familiar with most common 6 partial transition scenarios, why they're appealing, and their complications and the questions that might arise, let's dive deeper into what makes the decision between full and partial transition so impossibly complex. And I'm going to group it into 7 most common problems. By the way, still stick around because remember, I'm going to give you very important questions to go in depth if you are deciding on partial transition. Problem number 1, making decision between full and partial transition so difficult is when your needs might conflict with circumstances. For example, you might know that you need full transition to truly alleviate dysphoria, but your circumstances such as marriage, kids, career, finances, your health might make full transition devastating in other ways. So you're stuck asking yourself, do I prioritize my gender needs or my other life needs? Is there a way to have both? Am I fooling myself to partial transition am I fooling myself that partial transition is going to be enough? Problem number 2, making decision between full and partial so difficult is when partial transition might actually increase gender dysphoria. So, for example, sometimes addressing some aspects of dysphoria makes you more aware of what's still wrong. For example, getting top surgery might make you more dysphoric. Oops, excuse me. I'm gonna put it on airplane mode. Now I lost my track of sight. Getting top surgery, for example, might make you more dysphoric about your voice. Going on hormones might make you more dysphoric for bottom surgery. As a result, partial transition can become I fixed some things and now I'm more aware of everything else that's wrong. So it may bring up, instead of solving, gender dysphoria. Problem number 3, making decision between full and partial transition so difficult is when you can't predict future regret. For example, you might choose partial transition and later regret not doing more when you had the chance. Or you might choose full transition and later wish you'd preserved your marriage, your career, your anonymity. There's no way to know which regret you'll have until you reach a certain point. Problem number 4, making decision between full and partial transition so difficult is when other people's comfort isn't a good compass. What do I mean by that? For example, you might choose partial transition to keep your spouse comfortable, maybe your employer comfortable, or maybe your kids comfortable. But here's the question. If I make decisions based on other people's comfort, when do I get to be comfortable? Is that sustainable? Will I eventually resent everyone I protected? But also, if I prioritize only my comfort and full transition regardless of consequences, am I now being selfish? Where's the line between self-care and self-centeredness? Problem number 5, making decision between full and partial transition so difficult is when partial transition might be your authentic truth. Here's the twist. For some people, for many people, partial transition isn't a compromise that they have to make. It's actually what feels right to them. So maybe you're non-binary and partial medical or social transition reflects your actual identity. Maybe you're trans, but your relationship to medical interventions is very different. Maybe your gender is more fluid and maybe fixed transition doesn't match your experiences. But then the question becomes, how do I know if this is my authentic truth or I'm just afraid to go further? How do I distinguish between this is enough and I'm settling out of fear? And finally, problem number 6, or I think there's maybe 7 or 6, I'll have to see. Problem number 6, making decision between full and partial transition so difficult is when timeline becomes of an issue. For example, partial transition now doesn't mean you can't pursue full transition later, but it also might mean you're delaying interventions that become harder with age. You're wasting years in an in-between state that causes its own suffering, and you're allowing irreversible aging that hormones won't fix later. Or maybe you're building a life as partially transitioned that becomes harder to change. How do you know if you're being patient and thoughtful versus avoiding and delaying? And that's right, problem number 7, between making decision between full and partial transition, what makes it so difficult is when there is no right answer. This is the hardest part. There is no objectively correct choice between full and partial transition for your life. Let me say that again. There is no objectively correct choice between full and partial transition for your life. Every option has costs and every option has benefits. Every choice involves trade-offs. There's no decision that gives you everything you want without losing something else of value. I'm going to say that again. This is very important for all of you to hear. Every option has costs and benefits. Every choice involves trade-offs. There's no decision that's going to give you everything you want without losing something else you see of value, not at your age, because you accumulated things that you see of value. You're not solving a puzzle with one correct answer here. What you're doing is you're making a value-based decision in conditions of uncertainty with incomplete information about a future you can't fully predict. Keep that in mind. Now, let's explore what makes this harder, especially for older adults. In other words, why is this decision particularly difficult when you're over 25? And here are five most common reasons I've observed over my 20 years of working in the field. Reason number one, you have more to lose. It's simple as that, period. At 25, you might have some relationships, maybe an entry-level job, maybe minimal financial obligations. At 45, 55, you have a marriage, children, career, mortgage, aging parents, community, a reputation, retirement to think about. The stakes are exponentially higher. Reason number two, you have less time. I know. When you're 25, you think, I can try partial transition, see how it goes, pursue more, maybe later down the line if needed. When you're 45, you think, I don't have decades to figure this out. My body is aging, my life is half over. If I'm going to transition, it needs to be soon. The urgency creates pressure that makes thoughtful decision making that much harder. Reason number three, you have more responsibilities as you get older. Your choices don't just affect you, they also affect your spouse, your children, your aging parents who might not even understand, your employees or colleagues. You're not just considering your needs, you're weighing them against the needs of everyone connected to you. Reason number four, you have established identity. Some of you do. You've lived 40 plus years as a certain gender in the world. You have decades of memories and experiences, a sense of who you've been, relationships built on a particular understanding of you, a life story that partial or full transition rewrites. The narrative disruption is enormous in ways it isn't for young transitioners. Reason number five, you face age-related limitations. Medical transition has different outcomes at 45 than at 25. Hormones work more slowly. Passing is harder for many. Surgical risks are higher. Your body has already been shaped by decades of wrong puberty. These limitations make your question, is partial transition pragmatic acceptance of reality, or is it giving up? Which is a healthy, normal question to ask yourself. Now, and this is very important part of this video that I ask you to stay for. If you're here, it's probably just as important to you. The questions that need answering. If you are facing decision between full and partial transition, here are the questions you need to answer. And I want to be very super clear. These are questions that don't have easy answers. These are questions that require deep work, time, and expert support in majority of the times. Question number one. What is the minimum intervention needed to reduce your dysphoria to a manageable level? Not what would be ideal, but what is the threshold of relief you actually need to function. Question number 2. What are you actually willing to lose? Not what you should be willing to lose, but what you can actually tolerate losing. Please be honest with yourself here. Question number 3. You choose partial transition. If you choose partial transition, can you live with the dysphoria that may remain? Not can you tough it out, suffer it out, but can you build a life you want to live with some degree of ongoing gender dysphoria? Question number 4. If you choose full transition, not partial, full transition, can you live with the losses that come with it? Relationship losses, career losses, any career changes, financial strain, family estrangement. Can you actually handle those consequences? Question number 5. Are you making this decision from fear or from clarity? For example, fear says, I can't handle the consequences, so I'll settle for less. Clarity says, this approach actually aligns with my values and goals. How are you going to tell the difference? Question number 6. Is this decision responsive to your current life stage, or are you compromising your authentic self? Sometimes partial transition is a wise choice for circumstances. Sometimes it's betraying yourself to protect others. Which is it for you? Question number 7. How will you know if you made the right choice? Hard one. What markers, for example, will tell you that this decision is working for you? What signs will indicate you need to adjust? How will you evaluate this over a period of time? Question number 8. Can you live with uncertainty? Because here's the truth, my friends. You won't know if you made the right choice for years. You'll have to live with ambiguity. Can you tolerate that ambiguity? Question number 9. What support do you need to make this decision and live with its consequences? This isn't a decision you should make alone. Your needs to be part of your needs, and who needs to be part of this process? What professional support do you actually need? Finally, question number 10. What will you regret more? Action or inaction? On your deathbed, what will you wish you've done? I know this is very dark, but it's a question that clarifies a lot of things. Now that you know the 10 very, very important questions to think through, if you're considering full or partial gender transition as somebody who's over age 35 and is struggling with, is it worth it? Here's what I want you to understand. The decision between full and partial transition is not something that I personally would recommend out for you to sort out on your own. You absolutely can. But as you can see, it is not as clear-cut, as black and white, as complex. And that's because this is one of the most complex decisions you'll ever make. And it requires psychological expertise, where a psychologist, a therapist, has an understanding of your dysphoria specifically, not some cookie cutting approach of dysphoria. Understand differentiating between dysphoria and other mental health conditions. Is able to process trauma that might be influencing your choices and help you examine your values and priority and manage anxieties of uncertainty. It also requires systematic thinking, which is understanding how your transition affects your entire family system, navigating any couple dynamics aspects, considering child development and timing, and balancing competing needs and values. It requires, in the very least, practical knowledge between medical transition and options and timelines, limitations, and all other strategic planning. And it requires someone who's seen all the outcomes. For example, I worked with clients who chose full transition and did so incredibly well. I worked with clients who chose full transition and regretted it. I worked with clients who chose partial transition and found peace. I worked with clients who chose partial transition and later needed more. You need someone who can help you think through your specific situation without an agenda about what your outcome should be. You need someone who can help you get clear on what you actually want versus what you think you should want. Process the fear and grief that's clouding any of your judgment. Explore the practical implications of each option for your personal life. Support you in making a decision you can live with and help you cope with the consequences of whatever you choose. This is sophisticated clinical work. This is what I spent 20 years developing expertise in. Decision between full and partial transition is not a simple choice between, I'm just going to go for this and I'm going to go for this. It's a complex value-based decisions in conditions of uncertainty with high stakes and no perfect answer. If you ever consulted with me, and by the way, if you're looking for somebody to help you navigate this, I'd be very happy to help. My information is down in the description, how to book consult, all down below. But if you ever consulted with me, which is free consult, you would hear me always say the decisions have to be situated, and I say this on my YouTube ad nauseum, within your psychological makeup, your psychological characteristics and tendencies, and your matrix of situation, context. What are your current circumstances? Are you married? Are you single? Do you have kids? Do you have a community? What do you do for a living? What are your financial situation? All of that has to be situated in it. This is not like a cookie cutting approach. This is why it's so, so important. And if you're facing these decisions right now, I want you to know it's okay that this is hard. It should be hard. This is one of the most difficult decisions a human being can make, especially at your age. It is. It's very difficult. When I work with clients, I don't have an agenda about whether they should fully transition, partially transition, or not transition at all. My agenda is helping them make the decision that's right for their life and supporting them so whatever comes next. Like I said, if you're struggling with this decision, if you're lying awake at night, running through scenarios, if you're paralyzed by the complexity, if you need someone who gets it, I'd be happy to help. You can find all of the information about my practice, how to schedule consult in the description below. And you don't need to see me for 6 months to a year for me to help you plan this out. But remember, you don't have to figure this out alone. And this decision is hard. It is challenging. It's not easy. Whatever you decide, know that it's going to be the decision that one way or another is going to be right for you because you have decided it. It's a complex, difficult decision. Deciding to partial transition is hard because of all of the factors that interplay. So thanks for watching. Hopefully this video was very helpful to you. Subscribe and comment on this video, sharing your experiences. And I'm going to see you all next time. Goodbye.